Right. Well, welcome to this webinar. We're going to talk about adrenal fatigue. Adrenal fatigue. Let me get going here. Hang on just a second. Adrenal fatigue is really one of the most common things that we actually see in functional medicine. Adrenal imbalances are probably the most common health problems we see in functional medicine. All right, so the first thing to understand about adrenals, we need to look up at the adrenals, how they work. We've got a lot of information I'm going to be going through. Let's see, I have some doctors on here, we have some patients on here. This is really geared more towards doctors, but certainly patients will learn some things from here. So I want to move forward with this. Now, I've got a lot of information here, and I plan to have a recording of this. And if you want to go back and watch this, just get a hold of us, and we'll let you do this. Okay, so the first thing to really know about the adrenals is there's really there's really four main things that come out of the adrenals. So if I were to look at a kidney sitting right here, above the kidneys, we actually have the adrenal glands. Kind of looks like this. So there's three things that actually come out of this part of the adrenals. And one of them is what's called mineral corticoids. Don't get too excited about that. And then we have cortisol, and then we have DHEA. These are the three main things that come out of this section. In the intersection, that's where you get adrenaline, noradrenaline, epinephrine, norepinephrine. So let's talk about this in general before we get started. The adrenal glands, what they really are, is they're your sympathetic nervous system in your body. That's what regulates your sympathetic nervous system. Now, to put some context on that, your sympathetic nervous system is really what's considered your movement system. It's what causes you to move. It's what drives movement. Anytime you need movement, what do you need? You need fuel. So the adrenal glands majorly regulate the fuel in the body. And this is how they do it. So anytime you need energy to move, cortisol, which is a dominant hormone that comes out of the adrenals, is going to raise up, and that's going to put sugar in your blood so you can get readily available energy, fuel. And it's also going to increase your blood pressure, which is going to give you more oxygen, and that's going to give you more fuel. So if you want to move, you got to have fuel. If you have to have fuel, your adrenal glands are going to be largely responsible. Now, to understand the physiology of the adrenal glands, let's talk a little bit about these different layers. So there are four different things that come out of the adrenal glands, and it works out in layers. I apologize for this, guy. I need to go look at my slide. Oh, I don't have it in front of me. That's fine. Let's do it this way. I don't want to make this too confusing, and I apologize. But there are four, let's just count them, four different layers of the adrenal glands. And it looks like this. The first three layers are in the cortex. This right here is called the cortex of the adrenals right here. And this is the first layer, this is the second layer, this is the third layer, okay? In that first layer, that's where you get your mineralocorticoids, and that's where your aldosterone comes from. Basically, just know this is how you retain sodium. The middle layer right here is where we make cortisol. Another word for that is prednisone, right? So cortisol. And then on the inside layer of the cortex, that's where we make DHEA. All right. So let's talk about each one of these. First, mineralocorticoids. They regulate your electrolytes in extracellular fluid. Now, this is a key clinical point. This is the thing. If you have adrenal issues, if you're dealing with patients with adrenal issues, one of the things that we always need to support are electrolytes. When you give a patient electrolytes, it is like adrenal food. It actually helps those adrenals because the adrenals are regulating these electrolytes. And if you give the patient electrolytes, it takes a lot of stress off the adrenals. So I like to use electrolyte blends with patients. We'll also recommend things like Celtic sea salt. Celtic sea salt has a mineral balance that's similar to our blood. There's something even fancier than Celtic sea salt, and it's called Quinton water. It's more expensive, but it is even a closer balance to our blood as far as what the mineral makeup in our blood, ketone water. And I do believe that you can get ketone water from Quicksilver. So that's a resource for you. So mineralocorticoids maintain your sodium balance. Now think about this. Water follows salt. So if you need increased blood pressure in your blood, if you need increased blood pressure for circulation, then what will your adrenals do? Your adrenals will release aldosterone. Aldosterone will help you hold on to sodium, and then the sodium will be preserved in the blood. The more sodium preserved in the blood, water will follow, so you get more water volume, and thus you'll get higher blood pressure. So bottom line is, the adrenals will regulate blood pressure by the use of the mineralocorticoids. All right. Second thing, glucocorticoids. This is your cortisol. So this is your stress hormone, but there's something I really want you to know about cortisol. There's many functions that cortisol does in the body, but there's three major functions that cortisol does. And number one, it regulates blood sugar, and it regulates blood pressure, and it regulates immune system. And when I say that, I should say it differently. It modulates these. When your cortisol goes up, your blood sugar goes with it. When your cortisol goes up, your blood pressure goes up with it. Why is that? Because when your cortisol goes up, you get more sugar, more oxygen, which means more fuel for whatever stress you're under, right? So the immune system has the opposite effect. When you release cortisol, it dampens the immune response. A lot of functions of cortisol, but these are the three primary functions of cortisol, is that it modulates blood sugar, blood pressure, and your immune system. All right, so the next thing, that third layer in that cortex, that's where we make DHEA. This becomes an important player because when you look at, let's go through the process, cholesterol goes into the adrenals and makes something called pregnenolone. Okay, so pregnenolone is going to go down this pathway to make DHEA. It's also going to go down this pathway to make cortisol, and there's a whole different pathway it goes down to make aldosterone. Now, let me back up. So these are the three layers of the adrenal glands, right? This is the first layer, second layer, third layer. The aldosterone, mineralocorticoid, holds on to sodium. Cortisol modulates your blood pressure, blood sugar, and your immune system. Now, if you have somebody that has consistent low blood pressure, anything under 110 over 70, in other words, if they're 106 over 60, this is low blood pressure. And the most common, and I mean by far, the most common reason for low blood pressure is because you can't mount a good cortisol release, or you're not using it well. Either you're not making it well or you're not using it well. In either case, you have a deficiency of cortisol and you just can't keep that blood pressure up. Now, I don't want to go too fast into this, but for those who have actually seen some of these teachings before, you'll find that one of the things that really drives this process crazy is when you have blood sugar crashes. When your blood sugar crashes, your body uses cortisol to bring it back up. Well, over time, you lose your ability to make cortisol. When you lose your ability to make cortisol, now you can't hold your blood pressure up and you can't hold your blood sugar up. So it's this vicious cycle. Now, DHEA, that's where we get our androstenedione that goes into testosterone and so on and so forth. So ladies have libido through testosterone. So if a lady has low libido, then this is going to be, can be from low testosterone. Now, here's the other thing, is that once a woman hits menopause, they no longer make estrogen from their ovaries. That's done. So now they actually rely on the DHEA, which makes androstenedione. Androstenedione goes out into the body and makes estrogen. So that's right. So ladies make their estrogen and their progesterone from this DHEA. So what happens with a lady who has poor adrenal functions that goes into menopause? It's not a good sight. And the reason why is it can be a bumpy road. I like to say that when you go into menopause, it's like this train flying in the air, and it's got to hit those tracks just right. Well, when your adrenals are off, you're going to be wobbling, and it's going to be hard for that train to hit the tracks right, and sometimes you can have a crash. The last thing I'll say before I move into kind of more of the adrenal function and how it goes physiologically is this. You cannot separate adrenal function from blood sugar function. Your blood sugar will approximate what's going on with your adrenals. So what does that mean? That means that poor adrenal function is going to be poor blood sugar function. And let's say it the other way. If you have poor blood sugar regulation, you're going to have poor adrenal function. All right, so let's move on. Going through here, sorry about that. All right, so then on the inside of the adrenals, we have the medulla. That's where you make epinephrine, norepinephrine. These are the guys that are very quick acting. So if you think about it like this, cortisol is a stress hormone. See, these are stress hormones. And when I say stress hormone, don't get the idea that I'm talking about emotional stress. It can be emotional stress. It can be physical trauma. It can be chemical trauma, physiological trauma, blood sugar trauma, whatever it is that's creating stress in the system. You're going to make cortisol to try to increase fuel to mitigate and try to deal with and adapt to that stress. Well, as it turns out, epinephrine and norepinephrine are doing the same thing. The only thing about it that's different is the epinephrine and norepinephrine have different target sites, but they're faster acting. Now, cortisol is pretty fast, but it's not as fast as the epinephrine. So if you need right now movement, like you're walking down a path, and in the side of your eye, you think that you see a snake moving. What do? You jump really fast before you even thought about it. Why is that? Because your top of your brainstem is actually hardwired with a nerve that goes from the top of your brainstem straight into that medulla adrenals. And when you see something out of your periphery right now, boom, you're going to release adrenaline and you're going to jump. That's what makes you move, right? Okay, all right. So let's move forward. I want to talk about very quickly about a guy by the name of Hans Selye. Before Hans Selye, back in the 1930s, somewhere in that area, about 100 years ago, he was one that coined the term stress as it relates to our physiology. Before then, they only used it for engineering terms, like when they're putting a bridge together, they'd see the stress points. But he started talking about stress. And he talked about there were 3 stages to stress. He said there's an alarm phase, there's an adaptation phase, and then there's an exhaustion phase. I'm talking about this because I'm going to show you clinically how you're going to be able to tell which phase you or your patients are in. All right, so that immediate alarm phase, everything's way up, cortisol's up, epinephrine's up, everything's up. Adaptive phase, cortisol starts waning, your DHEA goes up, and then your exhaustive phase, that's when nothing's up, and that's the true adrenal fatigue. Truth is, you can kind of toggle back and forth between these almost like a daily, weekly basis. You're not going to go all the way from alarm to exhaustion, because you're going to progress generally this way. It's just not a straight road. All right. So the very first thing is this. We talk about looking at the brain, the nose, and the mouth. Here is the hypothalamus, and here's the pituitary. So, and down here is the kidney. Above the kidneys, we have the adrenal glands. So this is called the HPA axis. When the adrenal glands release cortisol, it will go back to the hypothalamus, pituitary, to tell these places in the brain that the signal's been sent, and then it's a feedback. So negative feedback. So your pituitary sends ACTH to the adrenals, kick out cortisol. Cortisol goes back, and then says, okay, we've been, this ACTH signal's been sent, and so then you stop that process. So that is normal stress response. You get under stress, the pituitary is sending down, let me get my white out, pituitary is sending down ACTH, and then you're kicking out cortisol. Cortisol goes back to the hypothalamus, goes back to the pituitary, also the locus coeruleus, which we already talked about. That's just a stress mechanism in your brainstem that can fire this whole thing up. So it goes back to that, says, okay, we've got the message. So then you stop sending down the ACTH, stress response is over, everybody's good. In early response, though, and this is more akin to the alarm phase, when you don't have exhaustion, you haven't done this long term, but you're under a early chronic stress. In other words, stress has gone on for more than just a half a day. We've had stress for a week, or we've had stress for however long. So what starts to happen as an adaptation to this early response, this alarm response, we start making a lot more cortisol, and we actually start making a lot more DHEA. So let me back up. See how much DHEA we generally make versus 3 of those and 3 of those. That's what we generally make. And then epinephrine, norepinephrine, kind of 3 of everything, just to kind of give you an idea of the quantity. Well, you get into this alarm phase, look what you start doing. You start cranking out everything. This person's not sleeping as much, but they don't feel like they need to because they're wired, but they're beginning to get tired. So that's one of the hallmarks of adrenal problems. You get wired and tired at the same time. So in that early stage, we're making all kinds of epinephrine, norepinephrine, cortisol, and everything's high. We get into mid-stage, here's what happens. Now our cortisol begins to wane, but our DHEA still stays up. And I should say this. So mineralocorticoids, which are aldosterone, will raise blood pressure. That gets more energy to the body. Cortisol modulates blood sugar, blood pressure. That gets energy to the body. Epinephrine, norepinephrine very quickly gets sugar and oxygen to the brain and the body. So that's very much, all these things are geared to getting you energy. Well, DHEA is the odd man out because DHEA doesn't do any of that. So what is DHEA and what is its purpose? Well, as it turns out, DHEA will actually balance out the effect of cortisol, and it's nurturing for the adrenal glands, but it's also nurturing for the body because it kind of takes the sharp edges off of the cortisol, if you will. So it kind of relaxes that stress and keeps it balanced in a nice place. So what happens is you start having cortisol, your cortisol actually goes down, and in this phase, the DHEA is going up. So when your cortisol begins to fall, you can start getting fatigued, right? Because you don't have energy. Cortisol keeps the blood sugar, blood pressure up. When that starts waning down, you lose energy. When the epinephrine begins to fall, this is that adrenaline. You start getting a low mood, energy, and so on and so forth. When the DHEA rises, this is where you start getting oily skin and acne. This is one of the most common reasons. If a teenager has acne, there's going to be 2 major things that drive it. Number one, they're going to have reactive hypoglycemia, which is going to drive this process, and she's going to get acne, or it's a bacterial infection. So let me back up just a little bit here, right? Okay, so when you look at the brain, you have 2 basic elements that the brain needs for fuel. It uses glucose and it uses oxygen. These are the 2 things that give fuel to the brain. So if you have blood sugar that's crashing, or you have insulin resistance and your brain can't sense that you have sugar, either one of these is going to look like a drop in sugar. When you get a drop in sugar, the hypothalamus pituitary sends that ACTH alarm to the adrenals, and the adrenals kick out cortisol, and cortisol quickly gets sugar and oxygen to the brain. Now, when you're in the early alarm phase, no problem. You're getting all kinds of energy. But now you start getting a little longer down the road, you can't mount up as much cortisol. When you can't make as much cortisol, guess what happens? Now you start getting tired because you just can't get that energy, right? So that's all part of the process. Now, the next thing that happens is that DHE raises, and you give me a 15 or a 17-year-old female that has hypoglycemia, reactive hypoglycemia, and a lot of them do, not all of them, of course, but a lot of teenagers right in that stage, hormones are changing, that sugar gets bounced, and when that sugar bounces down, this cortisol gets to where it just can't mount that same level, and the DHEA is going up because they're in this adaptive phase, and whammo, they get acne. I don't know how many teenage females I've had come in, get their blood sugar worked out, get that liver healthy, and the acne just goes away. Happens so many times. Now, sometimes acne can come from bacteria, but the most common cause in this age group is going to be that DHEA going higher. And then late term, when you get late term, you can't mount cortisol. Now your DHEA is going down, your epinephrine's going down. Now here's what happens. When your epinephrine goes down, a very interesting phenomena happens. So when you stand up, right here's the top of your brainstem, this is your vestibular system. When you stand up, your brainstem immediately sends an alarm to the adrenal medulla to kick out epinephrine and norepinephrine. Why is that? One of the purposes is immediately your blood pressure will raise about 10 points millimeter mercury systolic. So if you're 110 over 70, when you stand up, your systolic will go 120. Why is that? That increased pressure pushes blood into the base of the brain. If you don't do that, gravity pulls it down. And these people, the hallmark with them is they stand up and they get dizzy, right? So when you get to that place where you can't make the epinephrine anymore, you're going to get dizzy when you stand up. So just as a recap, already in this mid stage, you're starting to get where you get a little dizzy, but you get here, you're really getting dizzy when you stand up. It's a hallmark. All right, so let's look at some history. When somebody has adrenal fatigue, there are going to be here's the 5 most common symptoms somebody has. They're going to have weight gain. It's not going to be like thyroid weight gain so much, but it's going to be kind of that central obesity, that insulin resistance looking thing because it's so tied to blood sugar, but they're going to have weight gain, fatigue, depression, digestive issues, and hormone imbalance. These are going to be the 5 most common. You might not find all 5 of these, but it's not uncommon to see at least 4 out of 5 of these in these patients. So when somebody has adrenal malfunction, there are some things that happen. And Hans Selye actually codified this 100 years ago. What he found was when somebody has chronic stress, their adrenals will actually hypertrophy. They'll get bigger because they're trying to crank out more. Their thymus gland will actually shrink because less immune system, and the gut will have problems, ulcers. Now, as we see, one of the reasons why is cortisol is a very important factor when it comes to making hydrochloric acid. So if you have high cortisol or low cortisol, it can make you have low hydrochloric acid. Now, if you have low hydrochloric acid not only breaks your foods down, but hydrochloric acid is what helps you activate the release of bile. It is what helps you activate the release of digestive enzymes. So really nothing happens good past the stomach if your hydrochloric acid is low. So these people are going to have more food sensitivities, and they're going to accumulate over time. They're going to have tendency to have more bloating issues, more digestive issues, and so on and so forth. And you're not going to fix that with giving them like a PPI or giving them this, that, or the other. You have to go through the hard work if you're really going to get to it and go through these adrenals. And then liver, of course, the liver is always messed up. So if somebody comes in and they can't stay asleep, they crave salt, they're a slow starter in the morning, afternoon fatigue, dizziness and standing up, these are all kind of things that also go along with adrenal issues. If you can't fall asleep or you can't stay asleep, if you perspire easily, that means you are sympathetic dominant. If you feel like you're under a high amount of stress, weight gain when under stress, stress eating, here's also a hallmark. This is a very important one right here. You wake up tired even after 6 or more hours of sleep. So let's talk about some of the things you might see on these patients. Pupillary reflex. So cranial nerve 3 is a parasympathetic nerve, and so it is what constricts your pupils. So when you shine a light, your pupils should constrict. If they can't constrict, or you shine a light in there and they constrict and open right up, this is a sign of low parasympathetic function, and that can fit a pattern of this adrenal issue. Crave salt. Why would they crave salt? Well, if your adrenals cannot release aldosterone properly, then you're gonna want more salt and you're gonna crave it. And let me go through this. We talked a little bit about this a while ago. So cholesterol goes into your adrenals and gives you pregnenolone. Pregnenolone is going to branch off one of three ways. DHEA, it's going to make cortisol and aldosterone. One of the things that happens when you are jamming down this cortisol physiology stress, chronic low blood sugar, maybe infection, food sensitivity, whatever it is that's causing chronic stress for you, you're going to go down this pathway so hard that you're literally going to block the DHEA and you're going to block the aldosterone. When you block the aldosterone, you cannot retain enough sodium, so you crave salt. It's one of the hallmarks of that. When your DHEA gets off, that's going to throw you into hormonal imbalance. This can cause low libido in women, but can also just cause poor balance in your hormones. All right. Raglan's. This is the test where you stand up. We measure the blood pressure sitting down, take the blood pressure cup off, put it back on, stand them up, and see if their blood pressure raises 10 points systolic, right? Bloated after small meals. This is because you have low hydrochloric acid. Brittle fingernails. When you have brittle fingernails, it's just a sign of poor metabolism. It could be from low thyroid, low iron, low adrenals. It's non-specific, but if you see some of these other patterns, weight gain, tired, depression, digestive issues, bloating, hormonal dysregulation, you see that and bloating, and you see this brittle fingernails, then you might think, okay, that might be from the adrenals, right? Chronic sinus issues. Why is that? Well, one of the things that happens is when you have low cortisol, you can't mount that cortisol up anymore. Your immune system is not dampened like it should be, so it becomes hyperreactive. Now you're reacting to everything. You got allergies and sinus issues and all these other things, and it's a weird thing, but your immune system is overreactive, but it is not effective. So therefore, you have chronic infections like bladder infections. You're thirsty even when well hydrated. That's the sodium deal. Fungal nails, because you just can't mount that defense. You got to have coffee to get going. You have a hard time falling asleep, staying asleep. And these are some of the things that you're going to see with people with adrenal issues. The systolic pressure should raise 10 points. Stomach acid is important. It's that gets low. When stomach acid is low, that's what's going to give you that bloating, because you get meat in there, you get something like that. You just can't deal with it. It just makes your belly big, right? Brittle fingernails and so on and so forth. Here's an interesting one for us as doctors of chiropractic. Here's one of the things that you'll see. We will see spinal torque and back pain. You'll see the shoulders roll forward. Watch this. You'll get a weak gracilis, sartorius, tight psoas, and piriformis. This is a hallmark for chronic low back pain, sciatic type pain, because remember, some people, the sciatic nerve actually goes to that piriformis, and if it gets tight in there, it can give you all the signs and symptoms just like a true sciatica, right? So here's one of the things we see. If you look at his hands right here, you see how you see the back of his hands? You should see it. You should see on the side, like gun holster position. But when those hands, when you see the back of the hands right there, what that means is the shoulders are rotated. Now, I want you to think about this. As a baby's born, they're born in flexion. And then as they begin to learn how to stand and walk, they go into extension until they get older. Once they start getting older, they start going back into that flexed position. Well, as it turns out, they don't have a lot of time to develop this. But if you look at the brain, the nose and the mouth, we have the medulla is right here, and right above that, we have the pons. As it turns out, the medulla has a lot to do with these flexor muscles. The pons has a lot to do with the extensor muscles. One of the things that happens when we have long-term adrenal stress, it can alter the way the pons is holding on to those extensor muscles. So you get this rolling forward. What's that going to do? That's going to cause chronic pain in the middle of the back. So if you're not doing this adrenal work, you're only doing adjustments on people, you're going to recognize this, because the people are going to come back They're going to come out week in, week out, week in, week out, and they'll say, Doc, adjust me between the shoulders because I got pain there. Last time you did it, it lasted real good for about 2 days. Then I lost the adjustment. Well, they didn't really lose the adjustment. What it is, they've got this chronic stress syndrome going on, and it's manifested in their body. Another thing, well, here's another one. You see this one right here, rolled forward shoulders. This also can lead to that head forward posture. There's something very interesting. Watch this. The average head weighs about 12 pounds, but when the head goes forward 2 inches forward head posture, it has the feel-like weight of 32 pounds. If you go 3 inches forward, you have the feel-like weight of 42 pounds. Now, this becomes a progressive problem because the farther forward your head goes, the more that weight is pulling it forward, the more your shoulders are rolling, and this is really a recipe for problems. There's a great study that Deed Harrison put out, a great chiropractor, and he actually was able to demonstrate in the study that forward head posture that looks even like this is going to alter your autonomic nervous system function. Guess what? The adrenal glands is all about autonomic nervous system function. So this is going to have that effect that not only your shoulders rolling forward and your head's going forward, and that's because of all this adrenal issue, your body doesn't have the energy to hold itself upright. Now you do this and it makes that problem worse. In a forward head posture, the head is held inches ahead of the center of gravity and so on and so forth. All right, so I want to show you just a few things in blood that you might find if you're looking at patterns. Remember, we always look for patterns. You know, we look for patterns. One of the patterns we see is, do they have fatigue? Do they have weight gain? Do they have depression, hormonal imbalance? Do they have digestive disorders? That would fit a pattern of adrenal issues. Is there pupillary reflex? Is it sluggish or it doesn't happen? Do they get dizzy when they stand up? When you take their blood pressure, does it go up 10 millimeters mercury? Do they get bloated after they eat? These would all fit a pattern of adrenal problems. Now, let's look at some blood that would fit patterns of adrenal problems. One of the things we see on our CMP, the most common thing is you're going to see sodium. Sodium should be 140 to 144. When it goes below 140, even at 139, it's a sign of poor aldosterone output, which is a reflection, an indirect reflection of adrenal issue, or it could be direct, right? So that's the most common thing that you're going to see on that. But if you have a low anion gap, if you have low carbon dioxide, potassium's off, your electrolytes are off, these can also be signs. All right, CBC with differentials. There's a few things you really want to look for, and I'll just give you the quick stuff. You want to look, do they have anemia? Because anemia is going to be low oxygen, which is going to put chronic stress on the adrenals. Do they have a chronic infection? That's going to cause stress on the adrenals. Hemoglobin A1C, the sweet spot on that is 5.4 to 5.5. If you're above that, you're insulin resistant. If you're below that, you can still be insulin resistant, but you're probably at least reactive hypoglycemic. So you got a low blood sugar or high blood sugar. Now, the way it reacts is this. I caution you, if you have a hemoglobin A1C at 5.4 or 5.5, this is what normal sugar is supposed to do. You eat food, let's say fasting is 85, you eat food, it goes up, and then it comes down, and then you goes like this, and then you eat again, right? And let's say you average 5.4 with that. Well, what happens if your sugar's doing this, right? So your sugar might be bouncing all over the place, but you average perfect. So don't just use hemoglobin A1C. Thyroid, all right, so low functioning thyroid and adrenals work together. There's one thing, if you know about this, you know. If you don't, just skip past it. But one of the things that we can check is total T4 and total T3, okay? So total T4, perfect range is 6.5 to 12. Perfect range on total T3 is 115 to 180. These guys are relative to each other. So you can see how well you convert T4 to T3 by looking at these numbers. If you have somebody that is, let's say, 9.0 on the T4, but they're like 85 on the T3, that means it dropped they have poor conversion. One of the very top things that'll cause poor thyroid conversion is cortisol surges. So this can be a sign of the adrenal issues as well. All right, I need to get to what to do and what not to do. Here, okay, so I'm going to break this off into two things. One thing is going through this model right here, and that's what I'm going to finish up with. The next thing is we have testing. We have salivary testing. We have urine testing where we can check your cortisol, where we can check your DHEA, and we can get even a more specific picture than I'm talking about here. But if you have somebody that has the pattern that I've already talked about, here are the things that you want to, as a model, look at. The very first thing is lifestyle management. You're really going to have a hard time getting better with anything with the adrenals if you don't have good lifestyle management. You've got to make sure people are sleeping good. One of the top causes of people not sleeping good is blood sugar dysregulation. So their blood sugar is up and down in the middle of the night. In fact, if somebody wakes up at 2 or 3 o'clock in the morning and they have a hard time going back to sleep, that's a hallmark of dropping sugar in the middle of the night. So you want to make sure you're regulating their blood sugar good. Exercise. It's going to be difficult. Here's the hard part. People have true adrenal fatigue, don't feel like exercising, but it's imperative that they move their body at least to the level that they're able to move the body. It's going to be hard to overcome this without moving the body. Stress reduction. If you're under a lot of stress and you have ways that you can reduce that, you got to do it, right? Prayer, other things can help, hobbies and different things, and getting yourself out of stressful situations that you can get yourself out of within the parameters of what would be right things to do. All right, an anti-inflammatory diet. Stop eating sugar, right? Get off of gluten. Get off of dairy. Cheese is probably not so bad unless you're sensitive to and react to it. But get off these glutens. Get off these grains. Stop eating sugar. Get off of these, preservative foods that are boxes and bags and sodas and drinking and these protein bars that aren't protein bars but are candy bars. All these. There's good protein bars out there, but just watch what you're doing, right? So start eating better foods. Get some rest. Move your body and reduce your stress. These are going to be very important. And I really should put on here, I don't have it here, but it would do well to also watch toxic burden. Reduce the amount of plastic exposure that you have. Stop cooking with plastic cookware. Stop drinking coffee with those soft lids. Stop drinking coffee out of styrofoam cups. Watch your footprint when it comes to plastics, right? So bail them out. This is an acronym I developed many years ago. It's going on 15 years ago. I developed this acronym, but this one is very specific for adrenals. Blood sugar management. This is primo. If you have blood sugar dysregulation, I don't care what you do for the adrenals. You can give them the best ashwagandha. You can give them the best whatever you want to, and it will not have a long-term effect if you do not have good blood sugar regulation. This is an absolute must. You can't get better with adrenals without fastidiously getting in there and doing something and modulating that blood sugar very well. Body balance. This is our chiropractic work. If they got forward head posture, I'm an upper cervical guy, so I have a bent that way. Get their upper cervicals correct so that you can have good balance in that hip. I have scores of patients who's improved from forward head posture. I'm sure you have as well. Anemia. Do they have anemia? Do they have iron deficiency anemia? If the ferritin is 25 or less, they have iron deficiency anemia. Do they have low thyroid, inflammation, low B12, low folate? These are all things that you can check. And also oxygen deficits. Guess what? When you have forward head posture, it's going to block your airways to some degree, going to reduce oxygen. Inflammation. A good place to start with that is food sensitivities. There's a lot, anything creates inflammation, plastics in the environment. It's a lot of things that create inflammation, but a very good place to start is simple food sensitivities. Infection, become an expert at doing, analyzing infections. If you're new to this, your first webinar, get a hold of me. I've done webinars on how to look for chronic infections. I'll be glad to send that to me, let me know. Everybody should be going through detoxes, liver detox. I do blood sugar boot camp. They're wonderful. They do well for people. The ones we use are even pregnancy safe. If somebody's not sleeping, job number one, we got to get you sleeping. So here's the thing, and I can do this quickly because I'm kind of running out of time, but here's AM and here's PM. Cortisol does this about 30 minutes before you wake up. It begins to rise, and then you wake up, it hits its peak at 30 minutes after you wake up, and then it does this through the day. That's what it's supposed to do. So cortisol levels are completely related to our sleep-wake cycle. In fact, they are a sleep-wake cycle. So if you have adrenal issues and you're sleeping poorly, you gotta do that right. That might just be sleep hygiene. Go to bed on time. Quit scrolling, your phone at night. Use a fan, use some noise, block out windows. Do those things. Make sure your blood sugar is good. Make sure you're not having histamine reactions. High histamine can cause people not to sleep well. Low progesterone, low testosterone, low estrogen can cause you not to sleep well. There's a ton of things that can cause you not to sleep well. You got to go through the models and figure out which one they are. And I think I might even do a whole webinar sometime just on insomnia alone. It deserves its own place because I've got a good friend of mine that says that sleeping is on the Mount Rushmore of health. It has to be at least one of the top fours. If you don't sleep well, it's hard to live well, it's hard to live long well, it's hard to prevent diseases, and it's hard to feel good, right? So sleeping, and if somebody needs a CPAP, by all means, get them on a CPAP, get those things moving. All right, exercise, move your body, a hormone balance, microbiome. So now let's back up. You've gone through, you found somebody has the pattern. They have all the pattern for adrenal fatigue or adrenal issues. So we are going to go through the process of making sure their lifestyle's good. They're sleeping good. They're, they're moving their body, reducing stress, reducing a toxic burden, and so on and so forth. The next thing we're going to do is go through these bail them out categories. Go through blood work or whatever you have to do to figure out what these things look like, and then go through and pursue that. Now, I want to say something real quick about forward head posture as it relates to breathing. So the link between forward head posture and mouth breathing. Here's one of the things that we see. I want you to look at this, all right? So you see this big airway right here? You can see it on that lateral film. Now look at this airway, how it's scrunched down. That's a forward head posture. Forward head posture is going to close down that airway, and when you breathe, you don't get as much oxygen in, right? Here's another one right here. Here's a pre right here. You see that, how big that is? And this is a post. This is a TMJ, which is going to help balance that as well. So this is a study I did back in 1998. We did spirometry. We had people breathe into a spirometry. We did 2 weeks of upper cervical care, adjusted them. Most of them just got one adjustment. 2 weeks later, we came back and did the spirometry again. What we found was statistically significant improvements in the way they breathe following 2 weeks of upper cervical care. So I bring this out because we're chiropractors. Make sure we're adjusting our patient and getting this right, and that's the reference for that. All right, so you want lifestyle management, you want to do the bail them out. Now here's the next thing, right? So adrenal support, how do we support the adrenals? Remember, there's 4 things that come out of the adrenals. You have mineralocorticoids, you have cortisol, you have DHEA, and you have the epinephrine, right? So here's what we do. All of your adrenal patients, you want to support them with electrolytes. You can have them take an electrolyte blend. I use something from Designs for Health, but I don't think that they have, the market cornered on that. I just happen to use there. We've had success with it. It tastes good, kind of a lemon taste. I like it, but you can go anywhere. Also, have your patients use either Celtic sea salt or Quinton water, right? Celtic sea salt or Quinton water. This will help remineralize. Regular salt is 99% sodium chloride, 1% aluminum, and a whole bunch of junk you don't need in your body, right? Celtic sea salt is about 86% sodium chloride, 14% manganese, magnesium, potassium, and all those good minerals that we need for good health. Drink plenty of water, but make sure you're supplementing with these electrolytes. All right. So here's the next thing. Oh, I'm sorry. Let me go. I want to say this. So cortisol, So one of the things you can do, if somebody has chronic low blood pressure and we know they have low cortisol output, licorice root is a great herb to help you retain sodium cortisol levels. It'll help bring that blood pressure up. Now, I don't use this as a treatment so much as you got to think about it. When somebody has adrenal issues, you got to work at it from two levels. You got to work at a support level, and you got to work at what's driving it level. Is it low blood sugar? Is it a chronic infection? Is it stress? What is it doing it? So here's the deal: when somebody has low adrenal function, and you figure out what's at the root cause of what's doing it, you still need to support the adrenals because you need good adrenal function for your body to heal. So you can use licorice root. I'll use it for maybe 1, 2, 3 months while that patient's starting to get better to help you retain your sodium or your cortisol. Some people need DHEA. Men can get away with taking DHEA. If you give a man 75 milligrams of pregnenolone and 75 milligrams of DHEA, a lot of these men will thank you because they do pretty well. Do not just give a woman DHEA unless you have lab, either a salivary index or the Dutch test to show you that they really have low DHEA. Don't give a woman DHEA if she's not low in it because it'll mess things up. The other hint about DHEA, the lower the DHEA is on a woman, the lower your dosage needs to be to start off. It's kind of different than we think. Somebody has really low DHEA, you think give them a lot of DHEA to catch it up. Don't do that. You want to start off very subtly. I like to do, ladies, DHEA, I like to do that, start at 5 milligrams. You know, a man, you can start them at 25 or 50 or even 75. Don't do that with a lady because you're going to mess her up. Remember, because it's a androstenedione. It's a male hormone, so you don't want to give them the same commensurate levels. You're going to have a problem, right? All right. So now, I do cortisol. If somebody has low blood pressure, I don't mind giving them licorice root if I know they have these patterns of adrenal problems. So on all of my adrenal patients, I'm going to do lifestyle management, go through the bail them out because that's where I'm probably going to find the drivers, and then I'm going to give them electrolyte. If they have low blood pressure, a lot of times I'll give them some licorice root, and I'm not doing DHEA on them unless I have lab evidence that they actually have a problem, right? So the next thing we need to do is balance out the autonomic nervous system. Remember, sympathetic nervous system, parasympathetic nervous system. This is your rest, digest, and repair mode, parasympathetic, and your sympathetic is your movement mode, and the extreme of that is fight or flight. So on your adrenal, we're supposed to live in the middle. Yeah, we go a little this way, we kind of balance. But these people that are going into sympathetic dominance, what's happening there is they're putting so much tax on the adrenals because the adrenal glands are your sympathetic nervous system in your body, right? So if you're sympathetic dominant, you're putting an inordinate amount of stress on the adrenals and you're going to have problems over time, right? That's what happens. So if you have somebody that's a sympathetic dominant person, even if they can't mount proper cortisol levels, but they're in that fight or flight mode, you'll see it. Their pupils are dilated. You know, they're prone for anxiety. They have digestive issues, all of these different things that fit that pattern of sympathetic dominance. Well, here's the thing. Magnesium and potassium are wonderful for these folks. Magnesium, potassium will take somebody that's sympathetic dominant and bring them more into balance. That's the reason why they even call it natural calm is a magnesium, because it helps calm the system. Magnesium is great for anxiety. It's great for these things. Why? Because it calms down that sympathetic dominance, right? So also vagal activation is great. Upper cervical adjusting, and I'm not a basic dude, I graduated Logan, but anything you're doing in the pelvis can also activate the parasympathetics. I have a bent towards the upper cervical because I have over 30 years experience with that. So upper cervical is wonderful to tone to get good vagal. Let me say it this way: when you're subluxated in the upper cervical, it's going to have a detrimental effect on the vagus nerve. When you correct that and get that flowing right, and your head's on straight, your vagus function is going to do what it needs to do. Gag and gargle, deep breathing, coffee enemas, Polar plunge, I don't have that on there, but polar plunge, any one of these or any one or more of these are really good vagal activators. What does vagal activation do? It balances out that sympathetic dominance, okay? Glandulars, well, that's easy enough. Now, I use something called cytozyme AD. This stuff is wonderful. My granddad used to use it with his patients. My dad used it in his patients. I think we have a history of about 50 years in our family of using cytozyme AD. And it's one of those nutrients that if somebody needs an adrenal glandular, you give them this, they're going to be like, I'm not stopping that because I love that stuff. That stuff works wonderful. If they don't have adrenal problems, it's not going to help them. In fact, if they don't have adrenal problems, it might cause them sleep problems and other things. So don't give it unless they have these patterns and you feel like they need that. I'm only going to do it when those adrenals are just getting beat up. Adaptogens. There's a lot of good research. Probably rhodiola has the most research on it, but ashwagandha is great. All of these are good, but rhodiola, Panax ginseng, and your ashwagandha are probably the most common, more well-known ones. You can generally find a blend, an adrenal adaptogen blend or adaptogens, and some people do very well with these. All right, so here's some things that can ding your adrenals. Stress, systemic inflammation. These are, okay, stress. You think emotional stress, it's definitely there. But if somebody has blood sugar, instead of doing this number like it should, it's doing this number, that creates a tremendous amount of stress. Somebody has a chronic infection, like from an old root canal, tremendous amount of stress. Somebody's eating gluten and they're highly reactive to it, tremendous amount of stress. Somebody is expose themselves to way too much BPA plastic and they don't clear it well, tremendous amount of physiological stress. So there's all the bailout stuff is physiological stress things that do that. Low oxygen, all this. Any of those things over time is going to cause you to have stress. And what is your one response to stress? Cortisol, so that you can get energy to the brain. Think about this. When you're under stress, what do you need? You need to move. And that might be mentally, that might be physically, might need to be emotionally, whatever. But when you're under stress, your body feels like it needs to move in one way or the other. Any movement is predicated upon fuel, and that's the reason why any stress at all is going to ding cortisol. Cortisol is going to set that in motion. This is a slow reacting. Over time, when the cortisol wanes, now you're just using epinephrine, norepinephrine, and after you do that a while, KD bar the door. That's the recipe for true adrenal fatigue. Food sensitivities, infections, anemias, blood sugar surges, dehydration, heavy metal burden, environmental toxins, traumatic events, electromagnetic radiation, and the list goes on. The list goes on. The list goes on. Poor protein malnutrition, poor sleep, caffeine. I think caffeine is actually good for you up to a point. Alcohol, never good for you. Leaky gut, toxic relationships, trans fat, medications, EFA deficiency, epigenetics, overworked, underappreciated. So let me recap. When you see these patterns of adrenal fatigue, you want to do lifestyle management. Get them sleeping well, moving their body, reducing their stress, doing those things we need. Get them on an anti-inflammatory diet. Stop eating sugar, stop eating junk food, quit drinking all your calories, and all this type of stuff. Bail them out. Do they have blood sugar problems? Do they have low oxygen? That could be anemia, but could also be forward head posture. That could be a poor circulation because they're overweight and they just can't get oxygen to their body because there's just too much stress on the capillary beds. Do they have inflammation from food sensitivity? Do they have chronic infection? How's the liver working? Do they have endocrine problems, estrogen problems, microbiome problems? Are they sleeping okay? These are all things that you got to look at for drivers and more to figure out what's really causing. Because remember, bottom line, you have adrenal problems because of stress. That stress could be emotional, it could be physical, it could be chemical, it could be physiological. There's stress coming from somewhere that's lasting longer than your body's able to cope with it. So now the adrenals are going down, Now you're having all these symptoms. Oh, you're gaining weight, you're tired, you're depressed, you have digestive issues, bloating, and you have hormonal imbalance. And we look at it, and all these things are applying. You're not going to fix this by just taking ashwagandha. We got to do the hard work, do the lifestyle stuff, go through the bail them out, figure out what that major stressor is, and then just support the adrenals. Give them some cortisol, or give them some electrolytes for sure. See if they need cortisol, see if they need, we don't give them cortisol, but do a glandulars or licorice root. Give them some DHEA if it's appropriate. Balance that autonomic nervous system. If they're sympathetic dominant, get them some magnesium, potassium. Monitor potassium levels, make sure they don't go too high. Do some vagal activation, get that head on straight, get your upper cervical going. Glandulars, cytosine A/D is wonderful. Adaptogens, ashwagandha, rhodiola, ginseng, all of these things are absolutely wonderful. Now, I did not have time to present a case. I will do something very quickly though, because I can't not do that. Okay, so let's look at this case right here. Cholesterol to triglyceride ratio. If you've seen my teaching, you see me teach on this all the time. Should be 2 to 1. So if your cholesterol is 202, then I would expect your triglycerides to be 100. And this patient, triglycerides are 60. So this patient is more to a 3 to 1 ratio. And what does that mean? All right. When you go 1 to 1, it looks like insulin resistance. When you go 3 to 1, remember, tri means 3 fats wrapped around 1 molecule of glucose. So if you have crashing blood sugar, you're going to suck up all those triglycerides trying to get at that little nugget of a molecule of glucose because you don't have enough of it. In fact, we go down here and we look at the bottom. The bottom one down here, we'll see LD. Anytime that goes lower than 140 and she's at 113, it's a sign of reactive hypoglycemia. So she does have blood sugar dysregulation. She's got adrenal issues. She fits the pattern. Look at this. She has depression, weight gain, fatigue, brain fog, hormonal dysregulation. These are the hallmarks, right? These are all the things that we actually just talked about in this whole program. So she has some adrenal issues. She has hypoglycemia. Well, I will tell you this. Where you start with this patient is at hypoglycemia. That's where you start. And if you look at it, you get some clues. BUN, anytime BUN is lower than 13, we've got a congested liver, more than likely. ALT is an enzyme found in the liver, should be 18 to 26. She's 14. That's liver congestion. That's probably where the blood sugar dysregulation lies because the liver modulates that. Her TSH is in that zone of a secondary pituitary, which is also blood sugar. Uric acid is high, which means that she's inflamed. So she has a ton of inflammation and she has blood sugar dysregulation. Now look at this. That ferritin is at 7 and she's iron deficiency, anemia. She's anemia out the wazoo. RDW is high. That's inflammation. So I will tell you right now, with this patient, if you will simply do a few things, you're going to see her pulling out of this basement. We got to regulate the blood sugar. We've got to reduce inflammation. Where do we start with that? Start with blood sugar. Start with food sensitivities. And the third thing is she has iron deficiency anemia. Let's give her some iron with vitamin C. And remember, when you take iron, it needs to be 2 hours before or after eggs or dairy because it'll block your absorption. So you do those 3 things, this lady is probably going to feel 80–90% better. Are there other things going on causing adrenal issues? Maybe, but lop these things off and it's going to be Pareto's principle. You know, you do 20% of your work and you get 80% of the results. But this is going to be more of a 90-10. You do 10% of the work, just get these 3 things going, she's probably going to do 90% better. Okay, so there's a lot more, but we are at the end of our program. All right, so the couple things here. I may do this again on the next webinar. I do not plan to do a webinar next month. But next time I do a webinar, here's what I would like to do, because I did not do it here. I would like to go through how to do salivary index and how to read that, how to go through and look at your Dutch test and how to read that, and how to understand, you know, what the DHEA here is telling you, what the cortisol is telling you, what the swing is telling you. But I will tell you, if you're just getting started with this, do this. It's really a great place to really start. Okay, so I'm gonna look and see if I have any questions. I don't see any, so I might have questions, but if I do not see them. I apologize. Guys, thank you so much for listening, being a part of this. I hope you got a lot out of this. God bless you, taking your time on a Tuesday evening to sit here and listen to this. And I hope it really helps you, whether you're a patient or whether you're a doctor that's trying to help people. I pray this helps you. Thank you very much, and you guys have a great evening.